This is a free webinar brought to you by Cleaning and Maintenance Management Magazine, along with our sponsors, Dial and Sofidel. But this one is called Health First, Cleaning for Health versus Appearance and Smell. What an important topic. Hopefully everyone here today, I know everyone here today, will take away some action plan, something they can do for their company or their facility. And we do have some here who are specialty cleaners, carpet and upholstery, hard floors. This information applies to you as well. We think of everything we do in the cleaning industry to make it a cleaner and better place. So as we move on, we do want to talk about a few points of the organization bringing you this webinar. As mentioned, I'm Jeff Cross. With us today, assisting in the background, we have Martha Schmidt, the ISSA virtual events producer. That is her, that's her picture. That's how she really looks all the time. And she can pop in and talk if she wants to. But digital image, great picture, along with Kathleen Misovic, the CMM managing editor. Martha gave us a smiley. That's good. We don't want to make Martha mad. She's running things in the background here. Cleaning and Maintenance Management Magazine is your magazine. It's the industry's publication, and you can get it in print format, digital format, website. It's all there for you. So if you're not a subscriber, be sure to go to cmmonline.com and get your free subscription. Just a few housekeeping points. We want you to interact. Use the Q&A portal. Use the chat features we've mentioned. Ask questions. And this will all be documented. So if you have a question that we can't answer in the webinar, there's a possibility we can get to you after we close the webinar in the next few days. We'll get a recording of this as well. So that will come in an email to everyone who registered, whether you're here or not. If you're not here, you're not hearing this, but you'll get a copy of this recording. It'll also be on cmmonline.com in the video section. So many ways to access the recording of this webinar. And you are muted to prevent background noise, except for our panelists. They're not, but you can make noise at your end. But we do want you to just sit back and enjoy the webinar and get the most from it. A little bit about ISSA. If you're not a member of ISSA, we invite you to join. Take a look at issa.com. You can also do an email to membership@issa.com. We have a place for everyone in the industry. We have a newly designed website, so you could poke around there and see what it's all about. But everything ISSA offers, all of its divisions and departments, is in this one spot, issa.com. So check it out after the webinar, not before. We do have two sponsors, as mentioned. Let's watch our first sponsor message, and then we'll introduce our panelists.
Every person that enters your facility is under your care. And that care starts with proper hand hygiene with Dial Professional Soaps and Sanitizers. As the #1 doctor-recommended antibacterial hand soap brand, Dial can be found in millions of homes. It can also help keep people in your facilities away from harmful bacteria that can be spread by hands. From our antibacterial foam hand soaps that kill 99.99% of bacteria in a single wash, to our antibacterial foam and gel hand sanitizers that kill 99.999% of harmful bacteria within 15 seconds, it's time to take care with Dial Professional.
A company we're all familiar with, and we thank them for their sponsorship. But let's talk to our panelists now. We have John Poole. He's the ISSA CIMS Assessor, among other things. John, welcome to the program.
Thank you, Jeff. Good to be here.
And where do you come to us from?
Well, I'm coming from Ackworth, Georgia.
Georgia.
North of Atlanta.
I detect a little accent, just a little bit.
Just a touch.
And we look forward to your expertise, John. We also have
Thank you very
Kathy
much.
Tarnaski, the Unit Director, SSC Services for Education, Oakland University. Kathy, when I saw Oakland, that's probably why I thought California.
You thought it was Oakland. Yes, 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 yes. No, we are in Rochester, Michigan. Great campus, and I'm really glad to be here today.
Great campus. Is it clean?
Of course.
Spotless.
Spotless. Perfect. I'm sure it is. Thank you for all you do as well and for joining us. And we have a familiar face, Dr. Gavin Macgregor-Skinner, Senior Director of GBAC. Gavin, how are the Australians doing in the Olympics?
I'm quite exhausted right now, Jeff. I've won a couple of gold medals this morning, so I'm recovering. It's not easy, but I'm coming to you today from a balmy Washington, D.C.
It seems like it's warm everywhere, but Gavin, stay cool and thank you for being here today. Last but not least, Tricia Holderman, the president and CEO of Elite Facility Systems. I think, Tricia, the word germ is part of your official title.
Yes, I am the germ girl, the germinator. And we have now put new on our business cards, Facilities Infection Prevention Officer instead of CEO.
I like that. Be different. But thank you, Tricia, as well for joining us. So these are our panelists. They're going to talk to us about cleaning for health. So let's move into our main subject matter here. Just a simple question. I'd love to hear all four of you offer a comment on this. How would you define cleaning for health? And ladies first. Let's start with Kathy.
How would I decide? We are all here. I'm here at this university to make sure that all the students, faculty, and staff and everybody is safe from germs. I think the key thing for me is training. And I think we can get into that a little bit later, but making sure all the team understands what they're using, what it's used for, and providing that safe environment because they know how to use the product.
Thank you. And Tricia, how about you? When people ask you this question, what do you tell them?
I tell them I'm in charge of the germs from everywhere from the design build side all the way through to the actual cleaning side. And I think that just as cleaning companies, we need to be more involved at the design build side so they're not putting things in the building that we can't disinfect. And then I think one of the bigger things that differentiates us from different cleaning is also the mode of transmission. We're just much smarter about keeping transmission to a minimum. Whereas when you're doing just an office building, we're not quite as cognizant of that.
Good points. Gavin, what do you think?
Oh, what I often talk to people about, Jeff, is who is responsible for protecting health when it comes to indoor spaces. And I think what I want to really put into everyone's head right now is that we are the managers of the environmental indoor space. And to do that, we've got to look at environmental management as part of the cleaning industry. We've got to learn how to manage the built environment successfully. We need to learn a little bit about the sciences, biology, chemistry, economics, human physiology, but the heart of being managers of the built environment, of the indoor space, is the process of learning. So it's really important that, cleaning businesses can grow, they can prosper, but they have to be using state-of-the-art environmental management principles.
Appreciate that. And John, I know you work heavily in facilities, helping contractors as well. What do you think?
Well, for the definition, I would say that we want to clean to remove dirt and biofilm, as well as the pathogens that are present. It's invisible. It's an invisible attack that's coming at us, and we have to spend time training our staff. We have to spend time acknowledging, and as building service contractors and in-house service providers, it's paramount that we continue to monitor what's happening in our communities, and in the communities, how we can be able to best set our service scape within the environment that we serve to keep it safe. And so, it's going to be a training platform that we have to look into. And this is why I'll discuss later when we talk about CIMS.
Fantastic. So different perspectives, all with the same vision, but different ways of looking at things, all combined gives us a great definition of cleaning for health. So the next point is something close to Gavin's heart. So he can take the lead on this discussion. Protecting the Built Environment, Cleaning for Health. Gavin, have you read that book? You're muted.
Yeah, Jeff. No, this is really important. This is Dr. Michael Berry's book that he wrote back in 1993. We celebrated 30 years of that book last year. That book was the textbook that you can see in this photo. Doug Hoffman, Dave Moore, Jim Manus, Barry Costa, Jeff Jones, Larry Cooper, and myself put together a curriculum that was actually funded by the US Department of Labor. And we actually focused on this cleaning for health, understanding that there is science. So we talk about data-driven cleaning, we talk about the science of clean. It all was the vision of Dr. Michael Berry back in 1993. And right now, what we looked at, through this whole process of, I think we did 54 workshops. In 2023, we trained 893 frontline cleaning staff. Our customers demand quality in everything we do. We can achieve quality in cleaning that contributes to safety and health, but to do that, we have to understand the cleaning products, the methods, and the materials we use. But more importantly, we have to learn how to measure and evaluate their effects. And that's probably the big gap that we found through that journey last year when we took this on, ran 54 workshops, was that lack of training, that lack of awareness, that lack of education, but the lack of the tools that already exist in our toolbox.
Now, this next point has some images of different languages, and this is part of your program you're talking about?
Yes, it is, Jeff, and it's really important to understand who the cleaning professionals in the US really are. Get right down to the neighborhood level, get down to the buildings, look at the commercial factories, the hotels, the convention centers, the airports, the schools, the universities, all those buildings, the government buildings, the non-government, real estate, every building, there's about 140 million buildings in the US. Why? Because the government tells us there's 140 million buildings. We know that. We know the number. We know that every building in the country has to be cleaned. And our cleaning professionals, we're such a diverse population that we translated the English version into 7 other languages. And what we found was there was a high demand for that training. So, what we identified in our Cleaning for Health workshops, Jeff, there was a problem. And that problem was there was an industry-wide lack of education, training, and professionalism. There was a lack of poor maintenance. There were health complaints. But we also discovered the solution. And that solution was industry education and training, improved motivation and self-image, improved maintenance that led to healthy environments, but also then led to the cleaning professionals and their companies being acknowledged for the work that they did, being, again, through improved status and pay. And this is such a real fundamental understanding that what we do is based on science, it's based on data, and we do have the ability to measure. So this was such an exciting journey that ISSA took last year that we're continuing in 2024 and beyond.
And part of why we're talking about this is because for everyone here today, all of you attendees, there are things happening out there that maybe you weren't aware of, maybe you are, and resources you can tap into. And ISSA is a great spot for you to figure where that journey starts. So Gavin, thank you for this, what you shared with us here. There's one other program we do want to talk about, and that's CIMS. And then we'll get into the main part of our content and talk about the science, as Gavin mentioned, and other points that you can apply in your work. But John, this is all you. Tell us about CIMS in a moment or two. What is it doing to help the Cleaning for Health journey?
Well, CIMS, first of all, is an overall business model that's designed to implement structure and remove chaos in the decision-making of the strategies a corporation is dealing with. Now, with that, this year, in 2023, we introduced 8 new sections designed to affect the environment that an organization is working in, because it addresses the GBAC areas of auditing, of being able to determine what disinfectant is needed, being able to assess a facility. We, as a cleaning industry, we get the building, we go into the building, but yet what is the system there that provides us the support that we're not having to make over and over decisions that should already be established in a protocol or in a practice? Well, CIMS takes that out of it. I mean, we provide structure. And in the structure, as I just mentioned, we have the GBAC alignment here that is going to bring the cleaning for health aspect to the business organization. So it's paramount that today, I believe, building service contractors, in-house service providers, even our strategic partners that are in the management of selling chemicals and being able to support our industry need to be aware of what does it take to affect an organization. What is the quality propositions? What is the service delivery? How do we pay for this? What is the money we're going to make? What about our human assets? What about the health, safety, and the environment? And then, most importantly, what are the strategies that are being developed from our management? So these are our 5 principal books that we have within the cleaning industry standard. And within that, it is designed to set a corporation up so as that they don't have to keep spinning wheels. They can put people in a job that understand what it is to implement strategies that can provide the equipment, the human resource, the training, as well as the practices and protocols for pathogen elimination within a facility. It's paramount that we have structure. We set employees up to succeed, not to fail. We put in those checklists that will be able to help that cleaner that's on the front line be able to succeed.
John, thank you for that explanation. What a powerful program. Just another way to bring everything together so it works. We all understand that clean can be a simple thing. Why aren't things clean? Let's move on and talk about that. Because if we know the science, where's the science? If we understand what that is, why can't we apply it? Let's start with you, Tricia, on this, being with your experience in the industry. How do you use the science to justify what you do and to help people have the confidence in the facilities you clean?
So several things, and I do want to say training is the absolute most important thing that you can do, because you want the employee to know, first off, what they're doing, but take it a step further and make sure that they even can understand it and explain it to a client, because there's many a times when a client is like, what are you doing? Why are you doing it? Being able to share that with the client and saying that you're doing this because it's healthy, because it's safer, gives them even a better perspective of what we're doing, what we bring to the table. As far as data goes, wow, we have, my favorite thing about the data is that you can use it to gross out the clients. And every time we gross out a client, it just enhances more about what we're able to do. What I have learned about data is while we can understand it at our level, we have had to dilute the information so that they can actually understand what we're bringing to the table. Most of the time we'll get like an RFP and it's like, we just don't even need the RFP. Let us come in and do the evaluation first. Let us figure out what you really need, what you don't need. Then we will give you the data. And we've done quite a bit of, especially the air quality, surface quality test as we're coming through and doing our first walkthrough. And then after our first week of cleaning and after our first month of cleaning, being able to give it back to them in a very easy to understand report. That goes a long ways for not just getting our contracts expanded, but also the width and the height of it. So we have kept contracts. We have some accounts now we've had for 35 years. My longest account is 42 years. So you do keep that because you keep bringing the updated information, the data that proves you're doing your job. Because they see a piece of paper on the floor, they think it's dirty. But if you can show them that the bio load is kept at a minimum, that will impress them. Use that data to your advantage. Use it in your marketing, use it in your training, use it everywhere that you can.
So 42 years, that's probably older than most of our attendees to this webinar.
Thank you, Jeff.
So, but congratulations, Tricia. That is a testament to keeping clients that long when we know the turnover can be so great. Gavin, let's go to you. I know science is important to you. In fact, you write an article in ISSA Today every issue, and it's called Show Me the Science. Gavin was adamant when he started this column that it had to be about science. So talk to us about the science. Why don't we apply this more in the industry?
Oh, it's so exciting, Jeff. We've got so many tools available to us right now. Indoor air quality monitors, which I just recently gave a talk in DC where I said, every school in the country should have indoor air quality monitors in the schools, because we know how indoor air quality affects creativity, productivity, thinking, reasoning, critical thinking, but also in hotels and other buildings as well. But I want to tell you a little story, Jeff, because it's so important within our profession to understand the science. So I recently went to a school which was affected by a flood event. And there was a lot of dampness in that. And so we set up some of our tools to measure both the surfaces as well as the air. And we were measuring, there was so much dampness that we set up an initial spore test for molds. And we found aspergillus and penicillin. And when there was no one in the building, there was about 129 spores being measured on the devices that we had. Then the people came into the building and that number went to 5,000. And then they started removing the carpet tiles. And guess what happened, Jeff?
Tell me, Gavin.
That number went to 60,000. There's your science. So suddenly, when the restoration, the cleaning people come into the school to start to do the wonderful work they do, understanding that if you aren't a manager of the indoor built space, you can make things worse. And we saw that going into a damp school led from 129 to 5,000. And when you started doing your work, suddenly you got 60,000 spores in the air at a given time. So it's really important. We're so fortunate now, Jeff, that we have so many things that, you know, when I was doing biological weapons years ago for the government, I would carry little black boxes and you wouldn't know what was in my black box. All those black boxes are now commercially available. And what I mean by that, the ATP meters, the UV black lights, the indoor air quality monitors, but also these newer technologies like using fluorescent LED lights and that combination where we can actually highlight the S protein on bacteria and see where there's bacteria on a surface. That's where it gets exciting. So it's not just the new and the wonderful, those tools, it's understanding that fundamental science. We clean with tools, equipment, and we clean with cleaning products that contain ingredients that have chemistry.
Thank you, Gavin. I know when I walk into a building and it's dirty, it's just, you wonder why and what can be done, especially in restaurants or food serving locations. But the science is there and we just need to apply it more. Kathy, any thoughts here on this topic with the work you do there?
I'll just add a quick thing that the science has really improved what the staff can do with dwell times and things like that. When you have dwell times that are 10 minutes, I couldn't promise you that staff is waiting around to wait for 10 minutes for a product to dry. But with the new science and these dwell times getting shorter and shorter, I'm confident that they are getting disinfected.
Are you saying we should follow directions on the label?
We have to.
Exactly.
Just on that,
John,
Jeff.
how does CIMS fit into this?
Well, CIMS is going to support the science. I think in that we want to look for best practices and protocols. Naturally, we teach the owners and the operations directors, we go into that level so as that they will develop a plan that's suitable to their business. And then they come back to section 2. I want you to understand this, okay? All the science is great, okay, but will the building owners and managers pay for it? I mean, you know, I think this is where we run into it in certain areas, in that we can propose a lot of different things that we can come in, but to start ATPing a commercial building, and then can we pass that cost on, okay, to the facility owner or manager or whomever it may be, are they going to pay for it? So I appreciate science. We have to have it. It provides us with the metrics that we need to understand within a facility. But we do not need to discount the psychological impact of people not going to work because they're afraid to go to work. And that applies to the worker as well as to the customer. So I look at things differently of where will people go if there is a situation, a pathogenic like we had with the pandemic, with COVID. After a while, it went into a kind of a panic situation. And, you know, our healthcare brothers and sisters, they got overloaded. They got hit hard. And so then there was fear there because we're all humans. So I know we have science, but my premise here is this, is that I've seen that we can go in through our workloading structure, which we have in CIMS, and you have to have a workloading plan. As an assessor, I want to see where are you getting your numbers in order to provide for the level of service coming out of that scope of work that the owner wants to have. Well, now when we start throwing things in here, to them, it might be extraneous. To us, it's important, but we have to find that economic balance so as that we can get the building as well as be able to provide that level of quality and health, because training costs money, ATP costs money. Everything we do costs money. How does it build into the workload? So as we're developing all this, we have to consider the net profit margin a company is going to have to either eat or ask for in their scope or in their, in making their proposal. I hope I'm making sense, but I know from being on the side of marketing building services, it is very difficult to sit down there and they say everybody's coming in and they're competing with you at 50 cents a square foot, you're at 65 cents a square foot, and you're trying to sell the metrics and you're trying to sell the science. So we have a balance here, and I believe and I endorse cleaning for health. Don't misunderstand me, but we got to be real on how we're going to do that. And the science hopefully can support us in order to achieve a higher dollar demand because of who we are. But CIMS provides that structure that we can sell to these building owners and managers because we have all the structure in place for training, for strategies, for workloading, to meeting their quality proposition. I hope I made sense there.
You do. And the thing is, anything we do better costs more, it seems. And
Always.
it's just always going to be that way. Has to be paid for, and the money has to be there for that. But let's move on and let's go to Kathy to start this next point, because thinking about the work you do there, Kathy.
Yes.
What are some high level things you think of when you think about areas you clean? Or is it carpet? Is it vacuuming? Is it the restrooms? What are the main strategies you focus on to make sure your facilities are healthy?
Yes. I came from the hospital world before coming to the university with SSC. There's so many different things that we do clean here that staff has to be trained. There's locker rooms that athletes are in and out of all the time. Those are treated different than a classroom may be treated. So some of the strategies, we do clean a lot of carpet. We do clean a lot of restrooms. But we follow, I believe, a really good program that I try to train my staff to clean the same way as they're in a room, whether you're cleaning a conference room or a computer lab or what have you. You clean it in the same direction so that you're hitting all those things every single time, those high touch surfaces and all of that.
Thank you, Kathy. And Tricia, what about you?
So we have started this probably 2 or 3 decades ago. Yes, I'm old. But we have actually started putting in what we call floaters, who are catching all the specific things that maybe not everybody needs to learn how to do, but they are truly taught on how to do that. And, we work for the NFL and the NBA. There's so many different things that go into doing a sports facilities. We have hot tubs, we have cold tubs, we have showers, we have basketball backboards that we have to get those fingerprints off of there. So those fingerprints have germs. During the pandemic, we had to wash every single basketball every single night. So at least we know we have our great general cleaners who can do the showers in the offices, but then we have our specialized cleaners, and we have found that has really helped us make sure we're catching all of the priorities, where the germs are going to be, where the high touch areas are. But they also have different tools on their cart than we would for somebody who is just doing the general cleaning. And it does take different equipment to do different types of cleaning that allow us to keep that place safe. When you have a multi-zillionaire personality sitting on a chair butt naked, you want to make sure there is not a germ on that chair that he's about to sit on. And that is a daily concern of ours when we're working at that level. And it's not any different than working in an ICU unit where we may have a family member come in and we don't know what that family member might be bringing in with them. We want to make sure we disinfect everything that we can. So we mainly do healthcare facilities. We only have one facility that's not a healthcare. Again, we've had him for 40-something years, so we let him stay on with us. But we have learned to just not even bid on any of the other buildings. We're only bidding on healthcare facilities because I don't want to bring all of the knowledge and the expertise and the expenses that we have to a facility that A, doesn't need it, and B, won't pay us for it.
Yeah, amen.
Good points. Good points. Gavin, any thoughts here? When you do your workshops, what you talk about more of?
We talk a lot about, Jeff, professional cleaners need to know what health issues there are in the indoor environment. And that's 2024, guys.
Yeah.
We're not in the Civil War or the Crimean War. We're in 2024, where we actually have methodologies. You look at how environmental managers have increased in their practices, but also it's become one of the most important professions today. Environmental managers are called on to address problems of health protection and social well-being, even considered as important as doctors and lawyers. That's what I want to see for the cleaning industry. That's what I want to see for the cleaning professionals. And to do that, we need to look at the indoor space as a holistic system. We need to look at the air, the surface, and the water that we use. And that's so important. I think, Jeff, people forget that dirty air leads to dirty surfaces because we have gravity. Dirty surfaces lead to dirty air. There's a great study that was published about 3 years ago that showed in a hospital the bacteria that was on the floor, anything that touched the floor was also on that piece of furniture. And then when you touched your hands on that piece of furniture, you got the same bacteria from the floor on your hands, and that led to infections. Right. And it's that simple understanding the chain of transmission. We talk about the challenges of cross-contamination when I take a cleaning cloth and mop and I move it from one room to another. These strategies today are about understanding metrics, key performance indicators, but more importantly, cleaning is no longer subjective. I'm really sorry, guys. Appearance and smell is so old hat. It is out. And if that's how you're making your money, you're not going to survive. I'm being really honest. It's understanding that if you don't measure, you can't improve.
So to me, cleaning for health means appearance and smell is going to be a given as part of that. If you do the cleaning, it all comes together. So thank you, Gavin. Let's stick with you, Gavin, on this next point, and then we'll get John's thoughts as well. What is this all about, and what does this mean for those in our webinar today?
Yeah, so what we've done at ISSA, Jeff, using the Global Biorisk Advisory Council, the GBAC team, is really tried to present a playbook. I think the whole industry as a whole needs more playbooks. I know Tricia does great work in locker rooms and gymnasiums. I know Kathy has mentioned that. When we talk about professional sportsmen or women or athletes at the university level, we're talking about cleaning for performance, and that's so critical. And again, we've seen now there's been outbreaks of COVID with the Tour de France this year, as well as the Olympics. What we've tried to do in this publication here, Jeff, is just give a very broad general overview of some of the tools you may not be familiar with, but are available. And I'm going to be really honest here. I can give you a price point for every tool that's on this page, on this table of contents. It's not cost prohibitive. It's a lack of education and awareness, but also a lack of how to put that into your management strategy, your cleaning strategy, to show that you're doing it. When I see stadiums, and I'm talking about NFL stadiums, NBA stadiums, university athletes, they're going, Gavin, we bought one of those tools, those ATP meters. How often should we use it? And it's that lack of awareness of what the value of the tool is. A pre-clean swab versus a post-clean swab. Is there a difference in the numbers? Yeah, you did your job. No, there's not. Then go to another method. And so it's really important now of being able to take how dirty your environment is and visualize it. And again, you've heard me say, Jeff, I use a lot of floor plans. I use the traffic light system of red, yellow, green when things are clean, or more importantly, everyone says, is it still dirty? Yeah, it's still dirty.
Yeah. Well, in the chat, we do have we'll get to your question, Mark, about the quat binding awareness, because Malcolm says we should ask that. So I'm sure our Kathleen has made a note of that for our Q&A part. And then Mary Ann wants to know about where can we read this document? Gavin, where can this be found?
Yes, Jeff, it's available for free. That's what we like to do at ISSA. We like to help. We like to scale. We have this resource that was developed by subject matter experts, and it's on the ISSA website. But I'm pretty sure, Jeff, you and Martha, at the end of this, we can send out a link.
I think Rula, who works with us,
Got
has put the link in. So we've got it. All right. Thank you, Rula, for that. I tell you what, for time's sake, we need to move on, but it was already mentioned a little bit about indoor air quality. So let's talk about that for a moment. We think about cleaning the surfaces, right? And John, it's your turn to share a thought. How important is this in your perspective with cleaning for health?
I think it's very important. We walk into it and we're breathing it. So I think it's extremely important that we understand where we are in what environment, and in order to look at that as a, with CIMS now, with GBAC, one part of our requirement is that we actually consult with the building owner, the facility manager, to ask them what are they doing with the change of filter, what are their MERV ratings on the filters, and then we're auditing the areas of congregation, the traffic patterns. I mean, where is the pathogen coming into the building, where the portals, where the transmission points, how is it moving through a facility? As if someone will take that CIMS and spend the time and break it out, then here they will be able to provide invaluable assistance by just coordinating and asking the questions. Because if we don't have, they need the metrics to understand and be able to make any changes. If not, they're working in the blind. So CIMS provides that auditing tool. We look at SMART in order to develop the special, the strategic weaknesses, opportunities, and threats for a business. And that applies to a facility as well, because people come into a facility, they are a vector. And so we want to make certain that we can stop it where we can, or at least drop down the bio load on a door handle, elevator switch, things of this nature. So CIMS addresses all this, and in order for someone to become a certified CIMS company, they have to actually produce this document. So is that this way, it's a document explaining their facility, not just a macro facility, but the facility that they're working in, and then train that to the project manager, the lead, and the cleaners within that facility of what they're due on a routine cleaning basis, as well as an enhanced cleaning basis that would primarily be used to take care of a pathogenic infection that could enter into the building or in the community. We got to, people fail to recognize that as environmental cleaners, our staff does more to affect the environment in any building than any other person in that building. We're the ones, the cleaning professionals that are in a building, we affect that environment. So as managers today, we have to be smarter. We have to educate our managers. They have to go after credentials and learn, and they have to be taught. And, training is paramount. So is that when we go into the boardroom and people start asking questions about what are we going to do, you need someone qualified there to be able to make some form of an answer.
Thank you, John. We do need to move on. Let's have our next sponsor message. Then we have 2 more quick points, and then we'll do our Q&A. And we thank Sofidel for their sponsorship as well. Kathy,
Yeah.
what would you say in a facility like yours, not yours, of course, but another facility, what are they missing? What in their program they need to think about?
I think it's having a program in place so that when you're working with staff, you know there's consistency in your cleaning. So if they're cleaning, like I had said earlier, if they're cleaning the room in a clockwise manner, you know that they're hitting everything that they need to get. And I think that's the thing. You can't have cleaners in just doing free-for-alls how they want to clean, like they clean their homes. We need a process and policies and best practices, and to make sure that we're providing clean environment.
That sounds like a cleaning program of some kind. So
Yes, we do have some cleaning programs.
very good. Gavin, anything to add to this?
Yeah, yes, Jeff, just on indoor air quality, if you look at your phone on the weather app, there is here, in Washington, D.C., it tells me my indoor, it tells me air quality for outdoors today.
Mm-hmm.
Jeff, I don't go outdoors during the workday. If you keep a diary of how much time you spend indoors, we know through studies, people spend about 90% indoors. But there you go. There's your app.
Yeah.
So
Pollen is bad today.
What's that?
Pollen, it's bad today. Don't go outside.
Right. But what's the quality of the air indoors where you're sitting right now, Jeff?
No clue.
I'm not going to answer that question.
But we have devices, we have tools and equipment that can measure that. And what's important, if you're on this call today and you haven't gone through your protocols of normal cleaning, the cleaning you do at your routine cleaning in a building with an indoor air quality monitor, then do it. And you will see that when you use a cleaning product with chemicals, the volatile organic compounds, the VOCs, will increase. You'll see maybe other chemicals will increase. Nitric oxide, again, is a good measurement. Carbon dioxide is a measure for, is a proxy measure for the risk of germs in the air and getting sick. So whenever you measure what's in the air, Jeff, all those particles that you measure, that's the key number. So people talk to me about the size of the particles. No, I want you to focus on the particle count. Buy an indoor air quality monitor that has particle counts, because when there's more particles in the air, those germs that can make you sick, they piggyback and they take rides on those particles. Now, I know when I clean with any of the chemicals that I use and the tools I use, it takes I get a big spike in the particle count, and I also get a big spike in volatile organic compounds. It can take 15 to 30 minutes for those numbers to come back down. So if I'm cleaning, do I let people just come in while I know those numbers are high? If I vacuum and my HEPA filter is not working properly, or I'm using a vacuum without a HEPA filter, those numbers go through the roof into what we call the purple zone. But again, in about 20 to 30 minutes, they come back down. And that's why you have to become a manager of the indoor spaces, the indoor built environment, and you have to use measurement. And I want people to focus on indoor air quality, Jeff, and pay attention to the 4 Ds: distance, density, duration, and dilution. And the key to management is dilution. And we're seeing so much concentration, so much talk at the moment about the HVAC engineers ruling the world when it comes to indoor air quality. No, they don't. We do. The clean industry rules the world when it comes to indoor quality. And we focus on the 4 Ds, but more importantly, we focus on measurements and focus on the particle count, not the size, the particle count, because that's our biggest risk factor.
This is what I get for skipping Gavin on the IAQ question part. I knew better, but let's get one thought from Tricia, and then we'll move into our last point.
And on IAQ, or which one? Did we bounce?
Whatever. Go ahead.
I would like to go back to when we're talking about the programs. I mean, get a really good program in place, but be the experts at what you bring to the table. When I went and interviewed with the Washington Redskins, I walked in there and I was all excited about how I was going to kill these germs. And the guy just went, "Do you know what you're doing?" "Yes, I can get these germs away." Boom, had a contract. I was in that guy's office less than 10 minutes. These people want to believe we know what we're doing, and we can't know what we're doing unless we do the education first. We have the experience, we have the training, we have the knowledge, like Gavin. I mean, every time I listen to him talk, I learn 10 times more what I thought I already knew. This is what our industry needs to go, is where we are all getting together and discussing the best ways to take care of these facilities. And again, I'm at that point where I'm working with architects and designers all the way through to the cleaning crews. But that's where we can all be as an industry. We're the experts of what it takes to keep that building safe for anybody walking in, whether it's a multi-zillionaire athlete or a very ill patient, or a kid who just wants to learn his ABCs. This is truly our gift to the world, is to bring this knowledge to these facilities to make everybody want to come to them.
Well said, Tricia. Thank you for that. This is an important point too. Let's cover this for a minute. And maybe Kathy, you could talk about project work. How important is this to keep your facility clean? The carpet cleaning, the upholstery cleaning, not the daily stuff, the special projects.
No, it's important to keep carpets, upholstery, all of that stuff on a routine schedule to make sure that it's clean, and staff reporting spots and stuff like that, so we can get in and get those taken care of right away. But it's very important to keep it all clean.
Yeah, I just wanted to make sure we cover this a little bit, because we might think of cleaning for health as a janitorial, custodial, cleaning professional, everyday job, but these project jobs are so important as well.
Very much so.
Yeah. Let's go on and get into our Q&A. And I said we would start with that one question that was, let me find it.
The quat binding.
Quat binding awareness. What are the panelists' preferred disinfection chemistry for efficacy and safety? Of course, we're not talking products, but I think we're talking the science, the chemicals themselves. Who wants that question?
We have gone more and more out of the quat world and more to hydrogen peroxide based products, and we're just feeling, first off, back to the dwell time has cut drastically, which makes a big difference when you're working in healthcare. Some of our emergency rooms, they're putting patients in before we get a chance for anything to dwell. We've had great success with hydrogen peroxide, and we're using that probably 80% of the time now. And the places that we're not, it's because they already have a GPO or something in place that doesn't have that product yet.
Thank you. Anything else worth mentioning from Gavin, John, or Kathy?
I think hydrogen peroxide is becoming the up and coming disinfectant for today. I think it's easier, safer, and you
For everybody.
Questions.
I do too.
And it's not new.
It's not.
No.
And I think, Jeff, all the products that we have available work, but they work is if you follow the manufacturer's instructions on how they're supposed to work. And the challenge that we have, and I'm in facilities every week going, that's not how you use that product. Oh, look at the label. I can't read the label because I'm 57. I can't, the font's too small. But you got to get my point. The point is, it's not how do our professionals, how do our clean professionals learn? They learn by doing, they learn by visualization. Where's all those wonderful YouTube videos on how to use a cleaning product the way the manufacturer wants you to use it? They're lacking. So again, I know at ISSA we're trying to fill those gaps in the wonderful work that you do, Jeff. But more importantly, everything can work, but you've got to follow those instructions, and you've got to focus on, you've got to know what is safe and how to be safe when you're using it. And that's the biggest problem we have at the moment.
And which product, I'm sorry, and which product can be used on what surfaces? We're seeing, we've seen some damage with some facilities that we've come into where just the worst products were used for something and totally ruined it.
Yeah, Tricia, we just finished doing a survey of 56 hotels over the July 4th weekend. And because I was so busy, about 11 of the hotels told me, and I appreciate the transparency and the honesty, we actually increased the concentration of the product, Gavin, because we were so busy. And then one of the cleaners said, oh, I got a chemical burn on my arm, and she sent me a photo. And then I went back to the 56 hotels. Well, 32 of the hotels didn't want to answer my question, but at least 11 said, yes, we've had chemical burns in 2024 on our cleaning professionals, and that's the problem that we've got to address.
Well, we got to understand that the label is the law. OSHA will fine you, and if it's willful neglect, it's a $16,100 fine per employee. So I don't know how many employees you got, but they're out there, they're ready, willing, and able to come do their job. And if we as employers put people in harm's way, hey, we're asking for it. And it's real simple. That they look at that, because SDS, and that's the safety part of CIMS, is extremely important. But the key, what Gavin was saying, is that I go in there and there's not a dilution station. So my question, what do you use? Is it the glug method? And I mean, you really can't help but wonder if what they're using, and then your architectural damage, burns, contact dermatitis, and then they don't understand how caustic some of the chemicals are that are green, that'll burn your eyeballs out of your head. And they don't understand that, and they don't read it. They just buy it, go use it, no training. Thank you very much.
I
was
agree.
in a seminar once where they asked the students to pour like 4 ounces of water into a bucket. It was hysterical.
I bet it was.
How
Various.
you had 2 ounces to 13, 14. No one got it right.
Yes.
I'll get you on the metric system, Jeff. Don't you worry about that.
Well, understand.
I'm
that,
sure you will, Gavin. Someone in the chat mentioned that they use hypochlorous based chemistry. That's another one I hear a lot about.
Right.
Okay. A lot of questions on products. Here's one. We have a contract where we can't use any spray or aerosol cleaning chemicals. What is a sanitizer disinfectant solution for this? Would it be what you've already said? The peroxide or?
Yeah, and you can, when we've had clients that in most healthcare, you can't use spray bottles. So just put the pop top bottles in. They have enough holes in them that you can put the chemical on a wiper and start wiping like that. And you can still get it pretty drenched. But yeah, there's a lot of healthcare facilities you can't have spray bottles. So
Got to be cap and pour. Yeah.
Yeah.
Hey, Gavin, there's a question in the chat that just popped up about testing, which you've talked about. Equipment for testing soiling and bacteria levels on carpet and upholstery. Is there a way to do that?
Yes, there is, Jeff. And I think if we go back to our experience as an industry during the COVID, we were told, people, the government and others said, oh, you've got to clean high touch surfaces. Well, in my world, light switches and bed knobs is a Disney movie. We are more professional than that. And what was neglected was carpet and soft surfaces, chairs, couches, bedding, for example. And I think there is a way to do that. Again, we can do it, through many different methodologies, but it was a big gap that we saw. And again, you can use your different agar plates, your swabs, your UV black lights. We can use LED lights on those soft surfaces. You can get the old piece of sellotape, sticky tape, and put it on a carpet, and then hold it up and see whether it's clean or dirty or not. I use a lint remover. The old cloth lint removers. I carry one of those around, Jeff, and they go, oh, I clean this surface. Oh, good. I'll just roll my lint remover because it cost me 85 cents on the surface, and oh, look what I picked up. So again, going back to Clean for Health, it's about removing the dirt, the contaminants, the pollutants, and then disposing them appropriately so they don't lead to more contamination of other surfaces or other areas.
Mm-hmm. Very good. Here's a question. What's the most practical way to educate consumers so they seek companies that do cleaning for health and are willing to pay more?
Wow.
$1 million question. I don't know.
Yeah.
How do you talk to them? What do you do? How do you educate?
Well, you're going to have to go by reputation to begin with. I feel bad for some of the small companies I deal with in CIMS. They haven't established, they're trying to get into it, and they're looking for that first customer that can really propel them into, into our industry. So the entry point has got barriers, but I feel that if it's not the company that's established, then you got to look at the man or the man that's running it and look at his credentials. I mean, it's a tough entry point to get into this business. Once you're in it, I can't help but tell you that it's a fine industry to be a part of.
So marketing is going to be very important. And what you said about reputation, I agree. When I got the Dallas Mavericks, it was during the pandemic. They didn't even talk to anybody else. They literally picked up the phone and called me. Again, I've been around forever, but I have made sure that I am talking about germs at PTAs and Rotary clubs. And every time I talk at a Rotary club, by the way, I get a new dentist office to clean. It never fails. So go to Rotary Club. But I think when you're out there, it's not about like selling to them. It's about being the expert and proving you're the expert and bringing this free knowledge. Again, whether it's a PTA, a Rotary, a Lion, Chamber of Commerce, it's more about making these people see you at a different level than just a salesperson. It is walking up to them at a Rotary Club and chatting with them, and they go, but by the way, my kid came home with this infection from his football helmet, and boom, you have a client, because they know you know how to take care of their kid with this skin infection. They want you to do their building, and whether it's a Class A building or a healthcare facility, they want to know that you understand what it takes to take care of them. And
Thank
it
you,
is about reputation, but it is truly about being in front of the people. I don't go to Rotary clubs to get new clients. I go there to share information.
They have to know.
Always works.
Yeah.
And I think
We're
on that,
almost-
Jeff, the point is that you have to be able to tell your cleaning story.
Yeah.
That's it.
Mhm.
Succinctly and clearly what you do. And then you have to learn a bit about the science. You have to understand that if you're using evidence-based procedures, you can go to market with Cleaning for Health.
Well, that's a
Kathy, in your
15-minute
facilities.
elevator talk.
Yeah.
So
Well,
Kathy, in
and
your
people
facilities,
always ask how I get started. Well, for those of you who don't know, I've had 68 surgeries. I have Crohn's disease. I had so many infections when I was in the hospital. I turned that around and made that my business model. That's a great story. People love that. They're like, okay, she's had an infection. She's going to keep me from getting one. Use your own story, whichever part. If you're an athlete, you know what? You've gotten MRSA before from working out. Use those stories. Make these people understand that you bring it to the table, not just from the smart side, but also from your background side, your life.
so that applies well for companies like yours, Tricia. Kathy, does that work as well in a facility? That type of concept of sharing stories and information, because you're not selling a service, you're doing a service.
We're doing a service. So what our clients like to see is they like to see the end results. They like to see how many inspections we're doing on a daily basis, what those inspections look like, what they entail, the fluorescent light testing. We don't always do that for punitive. It's for training, teaching people what they're missing. That's the stuff the clients like to see on my end.
Thank you. We are about out of time, but I do want to close with an important question. I want each of you to comment on this. I think those who are with us, our attendees, will value this. The cleaning industry should be the authority. It should dictate everything about how we clean, how we take care of buildings, the whole cleaning for health concept. How do we make that happen? Beyond what we talked about today. We should dictate what happens in a building.
Define who is we,
The cleaning industry.
the cleaning industry. Well,
So
we're the professionals. It's obvious. I mean, we're the ones that do the job day in and day out. I mean, we see what is going on in the environment and the servicescape that we're serving. And, it only makes common sense. It's logical to me that we would be able to do what we need to do. However, we are intruded upon by regulatory agencies. California, now you got OSHA coming in, and they will have the rulemaking in November of 2024 on infectious diseases. But we're the ones that, as stakeholders, we're the ones that we put it together every day, every night.
I
I
agree
agree.
with you, John, but is it happening the way it should be? That's part of the question. Gavin, what do you think? I know this is something close to your heart. We as an industry should stand up and do this.
Yeah, and I understand what you're saying here, Jeff. There's no way in the world do I want the government either at a federal, state, local level to tell me how to clean or what to do. I want the cleaning industry, the whole value chain of the cleaning industry, from the manufacturers, the distributors, the resellers, down to the frontline cleaning companies, the essential workers, to actually, as a community, this is how we clean for health, and use the appropriate key performance indicators. Don't make measurement a niche market. Make measurement an everyday part of your business processes.
Thank you. Kathy, what do you think?
I I really don't have a comment on this one.
And we'll give Tricia the last word.
Yeah.
Okay.
Our webinar. Tricia,
So
bring it home.
the way that our company works right now is that we go out and do evaluations on buildings. So we are not really excited about getting an RFP. If we've been invited in to look at a project, we go in and create our own RFPs. And one of the hardest things about doing that is knowing that if I've created the RFP, so I know how many man hours I'm going to need, I know how much chemical I'll need, making sure that we create our own RFPs, because the client hands you a piece of paper that says, I only want to be vacuumed twice a week, but they have 4,000 people coming in the door. You can't just vacuum that. Declining clients or jobs that put our mission in jeopardy is not something I can do. I have a reputation. I didn't get the Dallas Mavs and Washington Redskins in 10-minute interviews because I sold to them. I gave them the promise that I would be the expert. I will take your money, but I will do the best job you will ever have. You'll have the safest building ever. And I think it's because we don't really accept RFPs. We'll look at those and use those as our guideline, but we create the RFP for our clients and say, here's what we're going to do for you. They take it or don't.
Yeah. Well, Tricia, thank you. That's a nice wrap up. We do have to end our webinar, but everyone that was here, thank you for being here. What great information. I mean, we just scratched the surface in many ways, but take what we talked about today, use it, be the authority. You are the cleaning industry. Thank you.
Yeah. Thank you. Bye, everybody.
Bye.
Goodbye.
Thank you.
Thank you, everyone.